Let me tell you the most common thing I hear when someone finally books a facelift consultation. I don't want to look like I had work done. Not will this hurt, not how long is recovery, not what does it cost. The first thing out of most people's mouths is please don't make me look fake. And I get it. I really do. Because for a long time, that was a completely reasonable fear. The facelifts that made it into tabloids and onto reality TV were often exactly that: pulled, tight, windswept. You could tell. Everyone could tell. And some of those patients looked like a different person, not just younger, just different. But here's the thing: that's not what modern facelift surgery looks like. The technique has changed, the philosophy has changed. The fear of that outdated outcome is quietly keeping a lot of good candidates from a conversation that could genuinely change how they feel about their face for the next decade or more. I'm Chris Lee, MD. This is Honestly, where I try to give you the answer you'd get from a friend who happens to be your surgeon. No marketing, no hype, no before and after promises that don't hold up in the real world, just the honest version. Today, we're talking about facelifts, specifically the question that most people are only asking quietly: am I too young? Will I look fake? Is it actually worth it? And the one I think is more useful than all of those is this even the right conversation to be having right now? Let's get into it. Here's something that might surprise you. The fastest growing facelift demographic right now is patients in their 40s and early 50s. The American Society of Plastic Surgery is reporting over 30% year over year growth in facelift interest in that age group. That's not a small blip. Something is genuinely shifting in how people think about facial surgery, and specifically when they think it's worth having the conversation. For a long time, the facelift was culturally positioned as a last resort, something you did when things had really gotten away from you. When you looked in the mirror one day and thought, okay, I can't ignore this anymore. My face is melting off. And that mindset meant most patients waited until their 60s and sometimes 70s, when the degree of change was significant and the correction had to match it. What's changed is a much more proactive philosophy. Patients, especially in their 40s and 50s, are starting to ask different questions. Not when do I have to do something, but when does it most make sense to do something? The term you're starting to hear is maintenance facelift. It's a less extensive version of a full procedure done on younger patients with earlier stage changes, designed to address what's there before becoming significant, with a shorter recovery and more subtle result. Think of it less as a renovation and more like keeping up with a house you care about. And there's data behind this shift now. A study published this year analyzed almost 100 revision facelift cases, patients who had a deep plane facelift and eventually came back for a revision. On average, they waited nearly 11 years. But the more interesting finding was about timing. Patients who had their first deep plane facelift before the age of 53 had results lasting an average of 12 and a half years. And those who had it after 53 had about 9 years. That's a meaningful difference. And it's a real argument for having a conversation earlier rather than waiting until you're trying to reverse things instead of preserve something. So, what's actually happening when your face ages? Let me give you a quick anatomy lesson. We've talked about this before, but this changes everything about how you think what a facelift is actually doing. Most people think of facial aging as a skin problem. Skin gets loose, skin sags, you tighten it up. Done. End of story. That's outdated. And it's largely why older facelifts produce that pulled, unnatural look. If you're only working on the surface and pulling it laterally, side to side, you end up with that swept appearance, that Joker appearance. The skin is tight, but nothing underneath actually is in the right place. What's really happening when your face ages is structural and deeper than that. Your face has a series of fat compartments, organized pockets of fat that give its shape and its fullness, its contour. The fat that used to sit high in your cheekbones when you're 28, over time, that fat descends. The fat along your jaw starts to fall and pool into your jowls. The retaining ligaments, the fibrous structures that essentially anchor your facial tissues in place, gradually loosen. And as those ligaments loosen, everything shifts down. There is no serum that addresses that, no laser that addresses that. Fillers can only temporarily mask it by adding volume. You can partially obscure the fact that things have descended, but there's a ceiling. At some point, you're not restoring the face anymore, you're just inflating it. You've probably seen what that looks like, and everyone has seen it. It's not the same as looking rested and refreshed. It's a different kind of problem. Again, we've discussed this in the past. A deep plane facelift goes to where the problem actually is. It releases those retaining ligaments, those deep retaining ligaments, and it repositions the fat compartments back towards where they were. And then it lets the skin redrape naturally over a structure that's actually been put back into the right place without tension. That's why the results look natural. You're not pulling skin, you're repositioning the architecture deep to the skin, and the skin follows without tension. And so this brings me to the next segment, which is talking about deep plane versus other techniques. I want to spend a few minutes on technique because you're going to Google this and encounter a lot of different terminology and a lot of marketing language, and I'd rather you have a clear picture going in. There are a few main approaches. The SMAS technique. SMAS stands for superficial musculo-aponeurotic system, a layer of tissue just beneath the skin, and that involves tightening that layer as part of the procedure. It's a legitimate technique. Plenty of surgeons advocate for it. It works well for the right patients, particularly those with milder early changes, and it typically has a somewhat shorter recovery. For a younger patient with early jowling and good skin elasticity, a well-executed SMAS facelift is a real option worth discussing. Now, the deep plane facelift goes a little deeper, and this is what's really in vogue right now, and there's debate on whether or not that's a good thing. It operates below that SMAS layer, directly addressing the fat compartments and the retaining ligaments. Full ligament release, tissue repositioning at a structural level, skin that redrapes naturally without being pulled. It's generally considered the gold standard for moderate to advanced aging, and it's what longevity data I mentioned is based on. The windswept look people are afraid of, that came from older techniques that relied on lateral skin tension, where they're just pulling, giving you that Joker look. Just pulling the skin tight to the side. When you're repositioning structure rather than stretching the surface, you don't produce that outcome. The skin doesn't need to be under tension because the architecture underneath is supporting it. Here's the honest part though. There's no single right answer for everyone. The question of which technique is appropriate for you, SMAS, deep plane, something in between, is a surgical judgment call based on your anatomy, your degree of change, skin quality, goals, and recovery timeline. It's not a decision you make by reading about it online. It's a decision you make in the room with a surgeon who actually is looking at your face. My job today is to make sure you walk into that room knowing enough to have a real conversation. All right, honesty scale time. If you're new, I rate procedures across a few dimensions so that you can see where something genuinely delivers and where the honest trade-offs are. So let's talk about patient satisfaction. I would give this an 8, 9. Facelift consistently ranks among the highest satisfaction procedures of all plastic surgery. Patients who do it and who had appropriate expectations tend to feel strongly that it was totally worth it. Now, longevity, also high. I'll give this about an 8. And this is one of the things that doesn't get said loudly enough. We're talking 10 to 15 years of meaningful result with a well-executed D-plane technique. Fillers last months to a year. Lasers and energy devices require regular maintenance. A facelift done well is a decade plus investment, not a short-term fix. So it's worth it. The recovery, the burden is real, and I'm not going to minimize it. A full deep plane facelift, you're looking at 2 to 3 weeks before you're comfortable being back in the world in a meaningful way. It's not pain, it's mostly social downtime. So you'll have bruising, swelling, tightness, it's not nothing. A maintenance level procedure on a younger patient tends to be closer to a week to 10 days, but these are ranges and not guarantees. Your specific recovery depends on the extent of your procedure, your health, and how well you follow post-op instructions. I want you to know that going in because you should. Now, marketing is a completely different situation. I'm going to give facelift marketing, a 6 or 7 because there are people who will give you some deceptive images that are only 3 months post-op and you're not really seeing the long-term benefit of a facelift. So that's why I give it that. Now, there is a fear versus reality gap. This is where facelift gets a worse reputation than it deserves in 2026. The fear is based on outdated procedures. The windswept look, the fake look, those outcomes are largely a product of an old technique and surgeons who are pulling the skin rather than repositioning the structure deep. Modern deep plane surgery done by someone who knows what they're doing looks like you, just better, just rested, repositioned. Most people around you won't know what changed. They just think you look good. I see patients who've been sitting on this question for 3, 4, sometimes 5 years because they're afraid of a result that isn't what surgery actually looks like anymore, especially here in the Northeast. That gap between fear and reality is the biggest problem facelift has right now. So let's talk about whether or not you're a good candidate. Let me be direct about who this is actually for, because candidacy is one of the most important things to understand before you book a consultation. Someone with early to moderate structural changes, early jowling, some mid-face descent, early neck laxity, someone with decent skin quality and elasticity, someone with realistic goals, not I want to look 25 again, but I want to look like myself, just more rested. A non smoker or someone willing to stop well in advance of surgery. Smoking genuinely affects healing in ways that matter, and someone who has a stable overall health. There's a reframe I find useful when patients ask me, am I too young? The better question isn't about age at all. It's, are the non surgical options still doing enough? When fillers and laser treatments and good skincare are keeping pace with what you're seeing, when you're satisfied, surgery isn't the right conversation yet. When they're not keeping pace, when you're doing maintenance and the structural changes are still advancing underneath, that's when the conversation shifts. Who tends not to be a good candidate right now? Someone expecting a dramatic transformation or a fundamentally different face. Someone with a very early aging where non-surgical options genuinely still have a runway. Active smokers, anyone with significant uncontrolled health conditions that would affect surgical risk or healing, and anyone who hasn't really sat with what they want and why. Because the goal of a facelift is to restore your face to an earlier version of itself, not to give you a new one. If you walk in expecting something different, that's a setup for disappointment, regardless of how good the surgeon is. If this conversation has made you want to explore it, let me tell you what a good consultation should look like and what should give you pause. A surgeon who knows what they're doing is going to evaluate your anatomy specifically, looking at your facial fat distribution, skin quality, and elasticity, degree of ligament laxity, neck, and jawline. It should feel as they're assessing your face, not just confirming you're a candidate and scheduling you. Ask to see before and afters, not just the curated best results, a range. What you're looking for is consistency and naturalness. If every result looks the same degree of pooled, that's a pattern worth noticing. If the afters look like the patient's just rested, that's what you want. Ask what technique they're recommending and why. Ask what recovery looks like for someone with your degree of change. Ask what the realistic improvement is, not the maximum possible outcome. Green flags are a surgeon who's honest about what surgery won't fix, someone willing to suggest a less extensive option, saying, actually, I think a neck lift might be the right starting point for you. A surgeon who gives you permission to wait. That one's underrated. Red flags, anyone who can't explain in plain language what they're doing and why. Anyone who jumps to maximizing what they can do rather than asking what you actually want. And anyone who dismisses your concern about looking unnatural rather than taking it seriously and walking you through why their approach addresses it correctly. Here's what I want to leave you with today. The facelift conversation has changed. It's not about dramatic transformation. It's not reserved for your 70s. And done well, it doesn't produce a result that announces itself to everyone in the room. The question worth asking isn't, am I too young? The question is whether the timing makes sense for your anatomy and your goals. And you can only get an honest answer to that in an actual consultation with someone who's looking at your face, not your search history. If you've been sitting on this question for a while, the fact that you're even asking it is worth something. Come find out what a conversation looks like. You might be surprised. If you found this useful, follow Honestly on Apple Podcasts and Spotify and Honestly Pod on YouTube. Leave a comment, share it with someone who's been asking the same questions. And if you want to have a specific conversation about your face, reach out to Clarioplastic Surgery. The link is in the show notes. I'm Chris Lee, MD. This is Honestly. See you out there.